Well, here's a wake-up call for all of us who don't get enough sleep. A new study finds that missing even a little bit of shut-eye, well, it can lead to a whole host of health problems, including heart disease, diabetes, and weight gain. The 5-year study was conducted by the University of Chicago, and its conclusion is basically this: hit the sack. Even 1 extra hour of sleep a night could be enough to make a difference and improve your health and save your life. Dr. Doug Livornese is a sleep expert with the Monmouth Pulmonary Consultants. He joins us this afternoon. You know, I got to tell you, I'll make a confession here. I have borderline sleep apnea.
Well, sleep apnea is a whole nother problem. The sleep deprivation, which sleep apnea actually leads to, I believe, is really the #1 sleep disorder in the country.
So tell me why this problem exists. Are we just too busy to find enough time to go to sleep?
Absolutely. It's society. Society now, it's a 24-hour day. You have light in the night. Think about it. When we lived in caves, when it got dark, we went to sleep. And when it got light, we got up again. Now it's light 24 hours a day. There's work, and there's TV. There's always something on.
Dr. Livornese, this is Mary Ann Silber. I had a quick question, because they always tell you, don't take sleep aids too much, but, some people just can't sleep. Like my fiance, he cannot sleep at night. And can you take things like, Tylenol PM? I mean, should people do that, to try and get that extra sleep? What are your recommendations?
The long and short of it is really no, you shouldn't do that. There are some few instances where sleep aids do help, but most of the time we're able to fix someone's sleep without using aids. Most of these aids actually make you sleep worse. Like you mentioned, the Tylenol PM. It's alcohol and Benadryl.
All right, here's the bottom line, though. If you're not getting enough sleep, if you're losing hours of sleep, how does it lead to heart disease, or which could lead to death?
Well, this study really didn't go into that, but one of the big problems with sleep deprivation is you get a lot more stress. And then when you're awake, you're tired, which makes you even more stressed. And that stress leads to probably increased hormones that can cause coronary artery disease. It's just like if you're the adrenaline and epinephrine.
Now, that's not a good thing. So the cure is to make sure you're getting your rest. How many hours do you recommend in order to avoid the disastrous effects of sleep deprivation, which is heart disease?
Well, in this study, they talked about 8 hours of sleep. A recent study from the general population, they asked people how much they sleep. They only slept 6.5 hours on average. So you just need to sleep more time, and you have to make time for it.
See, I can't find myself doing that. 4 or 5 hours, that's enough for me. I don't know why, but you're telling me that maybe I should take an extra 2 hours.
So you've got to get 8 hours straight of sleep? I mean, that's hard for a lot of people to do. I mean, we're on breaking news a lot of the time, covering hurricanes, tornadoes, things like that, and we're up all night long. I mean, sometimes it's just hard.
Yeah, what about naps?
See, well, naps are okay if you absolutely can't get your sleep block at one time. But you should nap within about 4 to 6 hours of when you're going to sleep, because then it actually makes you sleep worse at night.
Oh, okay. So the bottom line is, how long should I take a nap? 15, 20 minutes? Because I'm going to do that right after today's newscast.
Well, it depends what you're taking the nap for. If you're taking it just to get a little more energy, a 20-minute nap will give you about 2 hours of increased energy and increased concentration. And
look, doctor, we're not making light of this. This is a really serious issue because having talked to some doctors about sleep apnea, which could lead to sleep deprivation, they talk about, Kelly, be cool here, get your sleep, because it could lead to heart disease.
Oh, absolutely. I think as a whole in this country, we treat our sleep hygiene terribly.
Well, doctor, you've enlightened me. More medicine for me and more prevention. An ounce of prevention is worth a pound of cure. Thank you, sir.
Definitely. I've never had trouble sleeping,
so
fortunately.
I'm getting a nap after this.
So you can't yet. We have another show to do.
All right.